Hello, I am Dr. Ravi Charan Palwai, ENT Surgeon, Medicover Hospitals, Madhapur. Today, I want to talk about sleep. Sleep is a very important component of a human life. Where you have a sound sleep, you have a sound mind and a healthy world. That is the logo for this sleep day for this year. I just want to emphasize on the good sleep. A good sleep is a good 6 to 7 hours of sleep a person should sleep per day for regenerating his mind and the body. But in some cases, the patient may not have sound sleep. It can be because of snoring, or it can be because of sleep apnea. I just want to differentiate between a snoring and a sleep apnea. Snoring is continuous sound a patient or a person makes when he is sleeping in the night. But every snoring is not sleep apnea. Snoring, when it is continuous but interrupted by a pause, then we call it apnea. So, a person is gauged by how many apneas he has in one full sleep cycle per day. So, a snoring may not be very dangerous. A patient can snore because of obstruction anywhere from the nose to the larynx. But that doesn't mean that he has sleep apnea. So, when a patient comes to us with snoring, when we evaluate and we see that there is an obstruction to his airway, once we correct that obstruction, his snoring goes off. But sleep apnea is a very complex thing which depends anything from the airway from the tip of the nose to the larynx. When there is an obstruction anywhere, it can cause snoring, and when the obstruction is more, a patient can have sleep apnea. So, sleep apnea is a pause between snoring. People think that in between snoring, the snoring has stopped. But actually, a patient stops breathing in between snoring. That is called an apnea, and the number of cycles per day is called sleep apnea. Any apneas more than 5 in 1 hour is dangerous for the person. So, when there is an apnea, the patient stops breathing. There is buildup of carbon dioxide inside the body of the patient that stimulates the sleep center, and again the patient starts breathing. So in this few seconds, the patient is not breathing completely. This puts load on his heart. So a patient who has more apneic episodes in one day's sleep can have problems with his heart, his BP. Some people even can cause diabetes, and he can have daytime sleepiness and lack of concentration in his work. So, once we diagnose by history that patient has sleep apnea, we do a sleep study where it is calculated how many apneic episodes he has in one day's sleep. If the AHI is more than 5, then according to the severity, we do further investigations in like CT scan and then dynamic MRI and endoscopic airway assessment. In these patients, after assessing the patient, if his obstruction is less, then we ask him to take a CPAP. That is a machine where the oxygen is continuously pumped throughout the night. But if the patient is overweight, then we ask him to reduce his weight. And if he has obstruction and if his tongue size is big and he has collection of fat at the oropharynx level, that is at the soft palate by the lateral pharyngeal wall, then we advise him surgery for that, where the obstruction to the airway is removed, and after that we ask the patient to reduce the weight. then the results are very good and the patient's apnea will be gone, his snoring will not be there, and patient will have a sound sleep, and because of his sound sleep, he will have a healthy mind. Thank you.